Friday. Welcome to the 10 a.m. slot. I'm Dr. Phil Ross. I'm one of the chiropractors here at the World Wellness. And today I'm going to be talking about how to maximize performance and movement with chiropractic care. So we are basically going to kind of dive into, even if you're not in pain, why you would benefit seeing a chiropractor, what it does from a neurological standpoint. So for your brain and bodily function, and also for soft tissue. So we're just going to dive right into it. And Phil, is my PowerPoint up there? All right. So we're going to start, and we're going to talk about all the things that we could do as a chiropractor. So, big misconception. So, when I got back from grad school, all my friends that I played soccer with in college, they're like, "Oh, just go see Dr. Phil if you want your neck and your back cracked." There is so much more than we could do than just that. So, how you could benefit by seeing a chiropractor? We look at the patient as a whole. So we go over everything pertaining to diet, exercise, hydration, your biochemistry. So if you have any kind of comorbidities, any diseases, basically what we can do supplementation wise and diet wise to kind of help ease your symptoms and allow you to heal more efficiently. And then we also talk about mental well-being. So what you could do at home if you're stressed, anxiety. I know the past couple years has been a little bit tough, just with the whole the pandemic going on, and just certain things you could do to just kind of over improve your overall well-being. So when we talk about, let's just start with diet. So a lot of people think, again, you only want to see a chiropractor if you're in some sort of pain. So hey, I pulled a case of water out of my trunk and I hurt my back, or I just rolled my ankle in the parking lot. My hand's been hurting when I'm writing. I think I have carpal tunnel. So their diet actually is a major player in that. So the easiest place to start to kind of maximize your performance to feel the best is with a diet. So what you put in your body affects how you feel and perform. Good analogy is most of these, nicer vehicles on the market, you have to put the 93 in instead of the 87. There's a reason for that, because if you want a well-oiled machine, you have to feed it exactly what it needs so it could perform optimally. So couple different kinds of diets, and we'll talk to patients about what works best for you. And before we get into the diets, again, I just want to say, depending on your background, your genetic makeup, certain diets might work better for certain people. Recently, one of the big diets that everybody, it was a big fad, was the keto diet. So yeah, I want to drop some weight, I'm gonna do keto. That actually does have some good pros to it. So it is an anti-inflammatory diet because you're limiting your carbohydrates, and it will help you drop fat. So how keto works in a nutshell is to convert fat into energy. So your brain's the top dog. So your brain basically needs water, oxygen, and glucose. The pecking order of how you feed your brain glucose is carbohydrates, fats, and then proteins. So for the keto diet, usually it's a low carbohydrate diet. And so you're basically burning your fat for fuel. And how that works is to convert fat into energy. Your tags, your triglycerides have to be broken down into a fatty acid and a glycerol component. And then the fatty acids are oxidized into something called an acetyl CoA, which gets thrown into your TCA or your Krebs cycle. So that is basically how you create ATP or cellular energy for your brain. So a lot of people, when they just go straight on to keto, they're like, "Doc, past couple weeks I've been dropping weight like crazy." It's because you're literally burning fat to feed your brain. So if you're looking for a more anti-inflammatory diet and just a diet to kind of drop some weight, keto's a great diet for you. Mediterranean is probably the most heart healthy diet. Paleo is one of my favorites as well. Omnivore diet. So I think a little bit of everything in moderation suits a lot of people. And then you have your vegan and vegetarian diet. And again, what it comes down to is what works best for your body. Some people will respond great on keto. Some people do not respond great on keto. So that's where we come into play. So when you come in and we're treating you for either pain or just overall performance well-being, we will basically look at your body, see your body type, and then pick a diet specific for you. This is all custom tailored, just so you could improve your quality of life. All right, exercise. So, what we do in the room too is it's just not treatment. We actually help coach and aid people who are everyday warriors, like to exercise in the gym 4 to 5 times a day or 4 to 5 times a week. And yeah, 4 to 5 times a day is a little much, Phil. So yeah, we actually do. basically give tips on how to exercise at the gym, at home, just to improve your quality of life. So I am a chiropractor, but I also went for a master's in sports rehabilitation, and I'm also just this year got CCSP certified. So that makes me a certified chiropractic sports practitioner. So with all that being said, is you're not just coming in to get your neck adjusted, your low back adjusted. We are going to kind of go through a functional movement screen to see where you are deficient in certain movements. And then we could basically give you exercises that you could do in the gym to kind of facilitate more mobility in that fixated joint, or more elasticity in that muscle. So, and depending on your body type and what you're trying to do with your life, it differs in the exercises that myself and Dr. Orbach are going to recommend. So, if you are Ronnie Coleman, you are not going to train like a marathon runner. There are different components to how you want to look and how you want to feel. So, if you were an endurance athlete, so like an aerobic athlete, that is a slow twitch type 1 muscle fiber. So when you think of your runners and your cyclists, so we are going to take a different approach to what exercises they give you to do at home and at the gym, as opposed to if you were a power athlete, like an anaerobic athlete, which is basically going on a type 2 fast twitch muscle fiber here. So, um, yeah, so when you come in, we're going to take a look at what you want to feel like, what you want to look like, and then we'll kind of tailor exercises towards what you want to feel like. Also, too, people with osteoporosis post stroke, exercise is massive. So there, when we talk about, let's take osteoporosis. So, um, a the poster child for an osteoporosis patient is a thin, frail woman. So a shorter woman in stature and a little bit lighter in weight. How exercise comes drastic, how that plays a major role in osteoporosis is you need weight bearing exercises to increase your bone density. Um, can't stress that enough. So if you have osteoporosis and you just got your DEXA scan and you went from osteopenia to osteoporosis, you're having the progression of the deficient bone mineral density. Basically, if you're just going to go for a walk, 1 or 2 times a day for 10 to 15 minutes, that's not going to do anything. Not only are you going to have to kind of change up your diet, supplementation is absolutely key as well. So, when we talk about supplementation, we actually had a patient. She just came in. This was about 3 or 4 months ago. She got her DEXA scan 2 years, 4 years ago. She had osteopenia, which is before osteoporosis. And then 2 years ago, she got a DEXA scan and it said that she moved into the osteoporosis category based on her Z&T score. What we did is we got her on the Super Cal Plus and we got her on the Super K2 Plus because a lot of people just think I have low calcium. Let me take calcium and D3. If you just take D3 alone, it will show high in your blood serum. So when you get a lab work, you might have a high D3 level. However, it is massive that you take the K2 component as well, because the K2 component is basically kind of like the quarterback. So it's going to tell the D where it needs to go, where you're the most deficient in your bone mineral density in your body. So that's massive. And it was really cool because when she came in 2 months ago, she brought in her DEXA scan and she actually reversed it. She went from osteoporosis back down to osteopenia from the supplements. And we were talking about the weight bearing exercises. So the only pros to being an overweight individual is insulation and your bone density. If you're overweight and you're carrying around a bigger frame, you're going to have more bone density to kind of support your skeletal system. So, usually, what I do with people with osteoporosis is basically you want to put 10 to 15 seconds of time under tension in like exercises. So, for example, if we take a bench press, what you could do at home is you could go up to when you're at home, your kitchen countertop. When you go to do a bench press, you are basically going to push as hard as you can and maximally exert your muscles for anywhere from 10 to 20 seconds. And that is basically going to kind of trip your brain to put more calcium into your bones just to support them. So, there's a place actually in Green Street called Osteo Strong, and I had a couple patients go there, and great place. And what they basically do is they have a set protocol on different exercises you could do to increase your bone density. We teach that in here, both myself and Dr. Orbach. So if you, a family member, a friend has osteoporosis, and they're starting to decline, send them in here. We'll get them on the right supplements and we'll coach them the correct way to kind of reverse that change with home exercises you could do. Very simple, very easy. To a little clinical note, like a easy start. Christmas coming up. If you have any family member with osteoporosis, get them a 15-pound weighted vest. So when they're going for their walk from 10 to 15 minutes a day, if you have the weighted vest on, it's going to stress your bones and it's going to allow you to deposit more calcium into your bones. So there's a little clinical pearl early in the morning there, Phil. So that is the exercise component. Now, then we go to hydration. So, your fun fact of the day is for you to be what they call hydration, perfect hydration, you take your body weight, divide it by two, and that's how many fluid ounces of water you should be drinking a day. Easier said than done, but if you start first thing in the morning, and I always advise patients before you go straight to your coffee, first thing in the morning, drink 12 ounces of water. It's going to kind of wake your vital organs up and just give them a little pep in their step, so to speak, instead of just putting coffee, which is just going to sludge everything down for the rest of the day. So there's your fun fact for hydration. Body weight divided by two. That's how many ounces of water you should be drinking a day. And it depends on your activity level as well. So if you are an everyday individual versus an athlete, athlete is definitely going to have a little bit more water intake and a little bit more electrolytes just because from sweating and what they're burning off. And then cramping and spasms. So you don't have to be an athlete to experience muscle cramps. A lot of times I get people, individuals, 50s, 60s coming in. Hey, I got a muscle cramp in my calf. When I go to bed at night, like my hamstrings cramping on me. My pecking order on how that works is you got to be hydrated. So you got to have good hydration. So you're getting half of your body weight in fluid ounces of water a day. Then my next is going to magnesium. So a lot of people they'll talk about, oh, I just need magnesium, doc. Let me get it on Amazon. You could get it on Amazon, but it's going to be magnesium oxide, which is actually not bioavailable for your body. So we have the Mag Complete over there, Mag 300, and that has the three most bioavailable forms of magnesium for your body. So you have your glycinate, your taurate, and your malate. So a lot of times I just try and tell people, if you're going to get a supplement, everybody wants to jump right to Amazon, but usually you get what you pay for. So if you're getting a $10 magnesium supplement, magnesium oxide is not absorbable from your body. You're not going to get a benefit from it. So you got to be hydrated. You got to increase your magnesium. And then the last one, if people are suffering from any kind of cramps or muscle spasms at night, you could be deficient in a couple different minerals, trace minerals. So we have a mineral rich that a lot of people love. Me and Phil were doing a shot of mineral rich a day. We got off of that. We got to get back on that. And that actually has over 70 essential minerals that your body needs for everyday function. So that is my pecking order. If you're having any kind of muscle cramps, any kind of muscle spasms, come in. We'll assess you to see if you are deficient in a couple of minerals. We could order lab work to see if that's going on, and then get you on the right protocol just so you are not having all these spasms and cramps in your legs. Now, when we go to the biochemistry component, so the umbrella term for this conversation is going to be how to maximize your performance and movement through chiropractic care. If you have a comorbidity such as diabetes, peripheral artery disease, stroke, autoimmune, MS, Parkinson's, you're already kind of behind the eight ball, so to speak. So usually, if you have any of those kind of comorbidities, you're under treatment from a primary care physician. Bring in your lab work. I look at lab work, I would say roughly every other patient or every three patients. We will look and see where you're deficient in certain vitamins and minerals, or if you have a hormone imbalance, and we will try and restore that to your body so you can just perform optimal. And medications as well. I have a lot of patients coming in on medications, and some of these medications, they're actually throwing certain symptoms, and it's kind of hard to treat the symptom if you're not actually addressing the cause. So I am not a medical doctor. I am not condoning you get off your medication. However, there's certain supplements that you could take that could kind of help counteract your symptoms from your medication. So if you come in, bring in your list of medications for your new patient workup, we'll look at them and then we'll get you on the supplements that are tailored to you just so you can perform as optimal as you can. All right. So, misconception with chiropractors. Nothing wrong with old school chiropractors, but a lot of patients, including my grandparents, they just think, well, Philip, I don't want to come in and see you. You're just going to crack my neck and my low back. Not the case whatsoever. Do we provide chiropractic adjustments to your spine to restore mobility to joints? Absolutely. Can we do a lot more than that? Absolutely. So a lot of times people are coming in and they're like, well, I got some wrist pain, Achilles tendonitis, I got some chronic nagging knee pain. We could help with all that. So we restore mobility to fixated joints. we were talking about earlier, we could help with diet and lifestyle changes. So, if you have progressive osteoarthritis of your knee, your shoulder, if you have any kind of Achilles tendonitis, rotator cuff tendonitis, tennis elbow, if you have an inflammatory disorder or pathology is that causing you pain, we will talk to you about the correct diet to kind of help down regulate your body's inflammation, your systemic inflammation, and then get you on the right supplements to get rid of the inflammation, and then the right supplements to kind of help restore everything. So when we take the example, tennis elbow, doc, I was lifting up a gallon of milk and I felt some pain right on the side of my elbow here. Um, Lateral epicondylitis is basically what that's called. The suffix being itis means inflammation. So we will get you on the correct anti-inflammatories to decrease the inflammation over that lateral epicondyle, the bone where all the extensor muscles of your forearm originate. And then in the room, we're going to do a ton of soft tissue therapy. So think when you're having that tennis elbow, a lot of patients come in and say, doc, it's kind of bleeding into my forearm. I feel pain in the forearm as well. What happens is when those muscles get really, really tight, they're basically pulling on that bone where they attach, and then you get inflammation there, and then you get the pain, that tennis elbow pain. So what we do is we're going to get you on the right supplements to decrease your inflammation at the lateral epicondyle. And then we are going to do soft tissue work to some of the muscles that attach there, because we're trying to put more slack in a rope in this, in a sense. So if you have a tight rope pulling on that bone, if we release and put more slack in the rope, so to speak, it's not going to be irritating and pulling on that lateral epicondyle. We're getting great results with this. Kevin in the back, he's been off and on dealing with this, and I think it took him literally two treatments, and then the elbow, two treatments, and then he felt good as new. So that speaks to the power and the volume of our supplements. It's not placebo. They are no joke. If you look at the patented ingredients in them and in the soft tissue work in the room. So, we were talking about education for home stretching and exercises. We could order lab work, we could order images. If you have been seeing another chiropractor and you came in and you're having low back pain and you never had an x-ray, never had an MRI, with back pain running down an extremity, come in. We could order lab work. Sometimes you actually do need imaging at first, so you have an accurate diagnosis to go off of. Depending on what you're basically presenting with your symptoms. So sometimes we get an image right off the bat. Sometimes I do more conservative care. We'll treat anywhere from 4 to 6 visits, see how you feel, and that's usually my acute phase of care. So a lot of people that go to chiropractors, they say, hey, you got to come see me 3 times a week for this month, twice a week for the next month, and it's kind of overkill in my opinion. I throw the kitchen sink in patients, so you should be feeling better in anywhere from 4 to 6 treatments, and then we'll kind of talk about switching you over to a maintenance patient if need be. And again, we provide supplemental support. And where I like to kind of, this is my wheelhouse, is perform movement screening. So you don't necessarily have to be an athlete to go through these movement screenings. I do a lot of golfers for the TPI certification. If you are a grandparent and you want to hang out with your grandkids on the floor and not hurt your back, if you are if you're an older individual and one of your hobbies is gardening, and it's hard for you to kind of get down to work on your fruits and vegetables, we can give you we could take you through the movement screen to basically see again where you are efficient and deficient in certain movements, and then give you corrective exercises and home stretching just so you could do what you want to do. I'm a very goal oriented practitioner. So if your goal is, again, you're trying to play with your grandkids without pain, if you just started playing racquetball, I had a patient a couple weeks ago just started playing racquetball, started to have some aches and pains. We're going to take you through a movement screen to see where you're deficient, and again, give you corrective exercises at home and stretching routines you could do at home as well. All right. So if you are not actively in pain, how a chiropractic adjustment can benefit you. And actually, when I was doing this PowerPoint the past couple weeks, this is the number one reason why I would come in. You have a sympathetic and a parasympathetic nervous system. So, sympathetic nervous system is you see a bear in the woods. So, your pupils are going to dilate, your blood vessels vasoconstrict, your blood pressure goes up. So, you're in your fight or flight response. When you receive chiropractic adjustments at different levels in your spine, it instills a parasympathetic nervous system response. So, your parasympathetics is basically your rest and digest. So, when people are coming in, if you are high stress with work, high anxiety. And if you just kind of feel like you're fatigued all the time, bogged down, when you get adjusted by a chiropractor, it is going to instill that rest and digest nervous system, that parasympathetic nervous system. So you just feel better. And usually a lot of times when people come in and they get treated for the first time, they're like, Doc, I went home and I wanted to take a nap and like I felt like I wanted to sleep, 8 hours that night. And I'm usually sleeping 5 or 6. That's just what it does. You're trying to kind of trip that switch in your brain just so you're basically functioning at the right nervous, like the right parasympathetic nervous system. Sympathetics is good if you see a bear in the woods and you're trying to run away, or if you're crossing the road and a car's coming, you're going to hit by a car. You definitely want sympathetics there, but you do not want to run on sympathetic overdrive. That's going to have an increase of cortisol from your adrenal glands. Your C-reactive protein, your inflammatory markers are going to go up, and you're going to be way more prone and susceptible to any kind of illness or injury. So that's one of the big ones. And this is actually a study conducted by Spinal Research Foundation. And they basically said that chiropractic adjustments significantly increase the activity of the brain's prefrontal cortex, which is actually where higher learning and cognition happen. So not only is it going to put you in the right nervous system, your parasympathetics you're going to be running. The reason why I would see a chiropractor is you're going to feel better and more clear in between your ears. You're going to have more mental clarity. So, I mean, who doesn't want that? Honestly. So that's honestly, like, if I wasn't a chiropractor and I never see one and I was watching this for the first time, that's why I would go see one. You just perform a little bit more optimally. Mental clarity kind of focuses a little bit better. So this just talks about what also the prefrontal cortex does. And this is another. This is actually the article I got it from. And this article basically just talks about, and this is in my references, if you receive a chiropractic adjustment or manipulation to a dysfunctional joint, what it does for the prefrontal cortex. So again, it's going to help with your cognitive ability. It will help with your higher functions of your brain. And again, I don't know anybody that cannot benefit or use that. And we're just going to go into this as well. So one of the other things, the top three things it's responsible for is your joint position sense. How this can benefit you, whether you're an athlete or you're just a regular individual. If you were an athlete, and we'll see if it's on the next slide. So this is Paul Pogba, used to be one of my favorite soccer players. He went back to UV, not a fan of him anymore. But anyway, so we're seeing how he went into a tackle, and you could see how he's kind of on the side of his left foot there. So when we're talking about what the prefrontal cortex will do is how he is off balance and his right foot is going to have a really, really good next step, or else he's going to kind of fall on the ground. Is that's all prefrontal cortex. So you're picking up your joint position. So his brain is basically saying, Paul, you have to put this right foot down completely correctly, or else you're going to fall and you're going to fall on the ground. So that is basically trying to send the message all the way down from your brain, and you're going to hit your motor neurons, and it is going to tell him exactly where he needs to put his right foot so he keeps his stability. That's why a lot of athletes see chiropractors. I believe it's the Green Bay Packers. Don't quote me on this, but I think the Green Bay Packers in the off season, if you don't see a chiropractor once a week, you actually get fined by the organization. So that just speaks to the volume. And actually, every single NFL team has one chiropractor on staff. So a lot of them, they'll actually get treated the Saturday night before their game on Sunday. Not only for what it does for the joints in your spine and the muscles, but what it does for the mental clarity up top, and then just helps with your joint position sense. So how this can help. We were talking about, if you're a soccer player, you get nudged off the ball. When you are a football player and you see someone coming from the side and you're about to get tackled, if your brain and your prefrontal cortex is basically functioning at a higher level, you'll see those people when they bounce off tackles and they get the step and they don't go down. They're just more in tune with their body, their joint position sense. They just feel better where your body's at in space. A fancy term called proprioception. So and so it works really, really well for the athlete. And where it comes into play for just everyday individuals, if you don't feel, if you're a diabetic patient and hey doc, like the past couple years when I'm walking, it doesn't feel like my feet are connected. Like I feel like when I'm walking, sometimes my foot's getting stuck on the carpet. Sometimes when I'm walking up steps, I just feel like I don't feel my foot going up the step, and sometimes my foot gets tripped up on the step. we can help with that too. So chiropractic adjustments again is going to help with your joint position sense, so your proprioception. So if you're suffering from diabetic neuropathy, if you're aging, if aging like a fine wine, and you just don't feel like as coordinated as you used to, post stroke symptoms, vertigo, again, you just don't feel like your brain is having that connection with the rest of your body to function optimally. This is where we come into play. We do a really good job at just basically assessing your nervous system, and then applying adjustments to the correct places, just so again you could have a better connection with your brain to the rest of your body. So it goes off of that proprioception, where your body feels like where it's at in space is the technical definition. All right.
What's wrong with me
And
today?
then if you are an athlete or active individual, we were kind of going over that. Two massive advocates of chiropractic care, Jerry Rice, and I think actually the 49ers back in, shoot, I think that was the 80s. He was basically one of the pioneers that started talking about how we saw a chiropractor basically just to improve his performance on a football field. And then there's a quote from Tiger Woods about getting adjusted. He's the go to golf, and if he's doing it, I bet it definitely works. So they've been seeing chiropractors their whole life, and a lot of athletes see them just because, again, what we could do is we're going to restore motion and mobility to certain segments in your spine. We are basically going to take you through different functional assessments to see where you're deficient in movement. We could restore elasticity and kind of help lengthen muscles. And then we do great trigger point. Both myself and Dr. Orbach do really good trigger point releases. And then we are going to provide treatment to hypertonic or tight muscles, work out the trigger points, adjust certain segments of your spine depending where you need it. And it doesn't need to just be spine. I adjust, I mean, shoot, probably 10 ankles a day. We do wrist. I mean, any joint, any extremity joint as well. And then where athletes benefit the most is the dynamic stretching. So I do something it's basically called pin and stretch. So what we do is we shorten the muscle down. If you have a tight trigger point, like Doc, I was doing a preacher curl and I just feel like I can't extend my right arm as much as my left. I feel like I can't just lengthen it as much as I can. What we're going to do is we're basically just going to shorten the muscle, find where you have that active trigger point, pin it, and then stretch it back out so your muscle can get a little bit longer. So think the good analogy is your muscle should be very longitudinal, your muscle fibers, and should kind of orient and slide like this. When you have a trigger point, your fascia and your muscle fibers kind of get tangled up, and that's your trigger point. It's basically a sticky point in your muscle, so you're not sliding as you should. Over time, especially with the modalities we have with the laser therapy and the trigger point release, over time when we work on that tissue or that tight trigger point, we're going to allow that fascia and that muscle fiber to slowly get more organized and just basically act in a more linear fashion. So then when you go to do your preacher curl after a couple of treatments, you're like, oh, now I can actually straighten my arm all the way when I'm going to go do my preacher curl, and my muscles functioning properly. So that's how it works for the athlete. And again, I had to throw Jerry Rice and Tiger Woods up there. I mean, two goats right there. Um, if you and so that is basically for the maintenance or the well-being patient. If you were an injured athlete, and that's kind of where my certifications come in, basically trying to get an injured athlete back to his 100% potential. Love James Harrison. James Harrison is known for the care he takes of his body off of the football field. I can't remember if he said he spends anywhere around from like $300,000 a year just to keep him on the football field and healthy when he was playing. So, picture James Harrison with cupping. He also does acupuncture, dry needling, grass thin, myofascial stretch therapy, release therapy, and that's where we come into play too. So, if all these professional athletes are seeking out a chiropractor and chiropractic care for different treatment of not only if you're injured from like a neck or a back pain, but I see a lot of Achilles tendonitis. I see a lot of tennis elbow. I see a lot of rotator cuff tendonitis. Even if you have a small rotator cuff tear and you don't necessarily want to go for surgery, bring in your MRI result. You have four rotator cuff muscles. And there was a study that came out. This had to have been about 5 or 6 years ago. They took individuals and they gave them an MRI of their shoulder, and whether they were in pain or not in pain. And I think it was 87% of these individuals over the age of 65. It was a control study of 100 people. 87 out of 100 actually had at least a minor rotator cuff tear. So your shoulder is the most mobile joint in your body, the most susceptible to injury. That doesn't necessarily you have to go for surgery. when you go to a surgeon, they get paid to cut. So if you have a small tear in a rotator cuff and you don't have any bicipital tendonitis or any bicipital involvement, and if it's just one rotator cuff muscle, we could basically strengthen up the adjacent muscles, so you're not taxing that muscle and it's not getting the wear and tear, so to speak, so it doesn't just keep tearing. So I treat a lot of patients that they went to an ortho, they bring in their MRI, and they had, your supraspinatus is the most commonly one that's tore right up here. They have a minor tear. They don't go for surgery, and within a couple weeks, they're back to normal. They have no pain. So, we work on everything, not only spine related, but shoulders, knees, ankles. Plantar fasciitis is a very popular one around here. And if need be, the proper imaging. If you're at a standstill or if you're not progressing in treatment. For the non-athlete, how you could benefit seeing a chiropractor. So prior, I was talking about what are your hobbies? Again, I'm a huge goal-driven practitioner. So whether it is you want to be able to lay on the ground with your grandson or granddaughter and not think of how am I going to get up, we could basically give you different like stretches and exercises that you could do daily that prevent the progression of your chronic back pain, chronic knee pain, whatever's kind of ailing you. So we're going to improve the joint position sense from adjustments. That's that proprioception. So where your body feels at in space. We're going to restore mobility to the joints and the tissues so you could do what you want to do. Again, very, very goal driven, goal oriented practitioner. It is not a cookie cutter approach when you come in here. It's not like, oh, Bill's in, and then John's in, and then Craig's in, and they all get the I call it the flying seven, just like the normal adjustments. That does not happen. It is basically, what do you want to do in life, or what is your pain or your muscle imbalance or your joint dysfunction prohibiting you doing that you used to like to do. So we want to get you performing your hobbies, performing what you want to do, and is basically taking you through a movement assessment, checking if you're on any medications, giving you correct supplements, just so you're not having symptoms from medications. If you have a comorbidity, diabetes, peripheral artery disease, post stroke, anything like autoimmune, come in and we'll get you on the right, basically the right supplements to kind of decrease your symptoms. Stretching and exercise advice. There's only so much we could do in a room in a half an hour. So I'm a firm believer of if you're going to see me and bring your phone in. So it's very easy to demo you 5 or 6 exercises or stretches in the room. And when I see you next week, I was like, hey, did you do those at home? I forgot. So bring your phone in, take a video. So a lot of people forget. I would forget as well. So bring your phone in, and we'll basically take a video of myself or you performing certain exercises or certain stretches, just so you could take them at home. And again, we're doing everything to improve your quality of life and just have you feel as optimal as you can. Because a lot of people think they only have to see a chiropractor if they're in pain. Work with a couple different athletes, and my professional boxer I work with, he feels great almost all year round. And when we actually sent him for his lab work, he had 3 things that were pretty vital that were significantly off. And after talking to him, you're like, hey, if you take these 3 supplements, we're going to recess your lab work in 6 months and see where you're at. And he thought he felt great. And once he started taking those supplements and got 3 specific levels up, and actually 2 up and then 1 suppressed, he was like, dog, I felt good, but like now I feel really, really good. And his training's been going better. He's able to train harder and longer just from a couple different tweaks of his biochemistry by getting him on certain supplements. So again, you do not have to be in pain to see a chiropractor. If you just want to feel and be as optimal as you can every single day, you got to come in. You cannot feel bad leaving here. And then this last slide, basically just conditions we treat. Hiatal hernia. A lot of people think, oh, I'm having GERD, acid reflux. Doc, if I eat anything, I just feel like the burning. And I've tried to take everything over the counter and nothing's happening. Hiatal hernia is actually you wouldn't think a chiropractor could treat it, but it's actually more of a structural problem than a mechanical or a structural mechanical problem, as opposed to any kind of like chemical problem. So we actually get really, really good results with that. Actually, Bobby in the back, we just did that twice on him. And what was that, Bobby? He said he could having trouble eating rice, right? Did you hear him talking about that on Monday? Yeah, yeah, rice, right? Yeah, and then we did that and we got a pop in there, and then ever since then you were totally fine. Yeah, that was crazy. Yeah, and the cool thing about the hiatal hernia maneuver is that's usually like one or two, unless it's like a severe. If you actually went and got a scope and you have a pretty significant hiatal hernia, that might take a couple more visits. But um, people respond great with that. Neck and back pain, the radicular symptoms. So I have pain in my neck. It's running down my arm. I have numbness, tingling, pain. Some people say like staticky, spider webby sensation in my hand. We do great with that. We have a ton of modalities. We do cupping, laser therapy, something called IASTM, which stands for instrument assisted soft tissue mobilization. Long story short, just treating the muscle. So we have a ton of toys in that room that basically can take you from here all the way up to here, and you're going to feel as optimal as you can. Uh, any kind of tendonitis we do great with rotator cuff, Achilles. Just when we were talking about that class 4 therapeutic laser, that in a nutshell, here's my 1 minute laser spiel. Just how sun hits the plant for the plant to grow and heal. We are donating photon energy to your cells to allow you to basically heal 100 times quicker than what you normally would. That happens with a couple principles. So the photon energy hits your mitochondria. If we go back to 8th grade biology, your mitochondria, the powerhouse of the cell. More importantly, it goes in and hits just called your chromophore. It's a photosensitive receptor in the mitochondria, and it allows for an increase of nitric oxide, O2 perfusion, and an increase of ATP, adenosine triphosphate, which is your cellular energy. So it literally allows you to heal close to 100 times quicker than what you normally would. That makes my job so easy. And the cool thing about our therapeutic laser we have, the only byproduct is heat, but we use the heat in our favor. So when you heat collagen, mostly all your skeletal muscles, tendons, and ligaments are called collagen based. When you heat them to around 100 degrees, they become a little bit more pliable or mendable. So it's the same principle as if you're going to try and bend cold rubber as opposed to hot rubber. Once we saturate that tissue with photon energy and then start to strip out the muscles, your range of motion is going to skyrocket. So even just after laser treatment, we'll just use an example. If someone's having problems checking their blind spot when they're driving and they're kind of maxing out here, once we laser them and do soft tissue, it's remarkable just how much more range of motion you get, just from the muscle work and from the laser therapy. Uh, Post stroke. If you're having problems with post stroke, we do great with that. We do different vestibular exercises we could give you at home to do. Post concussion, seeing a lot of patients after hockey goalies actually. More so than not, but we could do a lot if you had a concussion. If your kid had a concussion, your grandchild had a concussion, bring them in. We are really good at getting you on the right nutrition, basically to kind of help your brain to heal, so to speak. And then we're going to give you basically different movements that you could do to kind of retrain your brain, just to kind of feel again better with the proprioception in the rest of your body. So headaches, muscle aches, acute chronic pain, sciatica, migraines, all this other stuff. And the what I'll finish with is we're not treating Parkinson's, we're not treating MS, but we could help with the symptoms. Currently, I'm actually treating one patient with Parkinson's and two patients with MS. And I actually co-treat. There's a couple clinics in the United States. One out in Arizona. I'm actually working with. The MD out there, and then we're treating this patient with MS. She's been diagnosed with MS since 2015. We're gonna have to see if we could get her on the video camera, Phil, because she's doing great. Her symptoms are drastically decreasing. She actually came in for she came in for plantar fasciitis. She felt better in like 2 visits, and then she was like, "Actually, I got some other stuff going on," and we talked about it. We ordered pretty extensive lab work, and we got her on the right supplements, and then I got her over to that MD in Arizona that is basically going to help treat her with high dose vitamin D therapy and K2 therapy, because there's actually a couple studies that came out recently that talk about how high doses of vitamin D coupled with K2 can significantly reduce and even put you in remission of your multiple sclerosis. So that's pretty crazy. Not a lot of people know that. There's actually a really good book out there on Amazon. I'll have to see if we could kind of attach it to this link here. Yeah, but the vitamin D therapy, what kills me is when you get your lab work. So the reference range is anywhere from 30 to 100. If you get lab work, if you're like 31 or 32, that's a green light. That doesn't flag, so to speak. So they're like, you're good. Your D should be significantly higher than that. So your D should be at a minimum like around 70. So what we'll do is, yeah, basically we are helping to kind of treat the symptoms of the MS and the Parkinson's patient. So things that you don't think you could typically see a chiropractor for, I bet we would shock you. If you come in, we're talking about just how your body feels, like the brain to the body connection, working on different muscles, ligaments, tendons, joints. And then I'm a big advocate of like home coaching. So what you could do at home exercise wise and what you could do stretching wise, we could basically take you and improve your quality of life just so you're optimizing your performance. That's the name of the game. If you have a chance to basically feel better and just like every day just have a better quality of life, why wouldn't you come in and get checked out? So that is my spiel this morning. So that was basically my talk at 10 a.m. And Phil, I have nothing else the rest of this week, right? No. So tune in for the rest of the day. We got some good speakers today, definitely tomorrow. And then we will see you guys next sale. So my name's Dr. Phil Ross. Thanks for tuning in, sticking with me, and we'll see you guys next sale.